Hello, my name is Karen Harden, and I'm a clinical nurse specialist at the University of Michigan Health System with an expertise in bone marrow transplant. We've prepared this presentation to help people get ready to go home after they have had an autologous stem cell transplant. This presentation is full of information that will help you prepare to leave the hospital after your transplant. It is appropriate for patients who have had an autologous transplant. Please watch it as many times as you would like, and ask your nurses if you feel you need more information on specific topics. Our goal today is to help you learn the knowledge you need to recover as well as possible from your stem cell transplantation so you can identify the symptoms that you will need to report, avoid infections that can send you back to the hospital or emergency room, participate in your favorite activities as much as possible, and transition into a new normal life. What will you learn today? You will learn what to expect the day of discharge and how to transition to the outpatient clinics. You will learn about the process of engraftment, immune system recovery, and taking care of yourself as your immune system recovers. We will discuss returning to activities and what is involved in your long-term follow-up care. We know you are excited to go home on the day of discharge, but on average, patients will not leave the hospital until about 5 or 6 p.m. This is so that we can evaluate your current medical condition, review your labs, and provide you with any last-minute medications, blood, or supplements your body might need. You can help on discharge day by arranging for pickup, filling your prescriptions, arranging for necessary medical supplies, and asking any questions you might have. You worked with the blood and marrow transplant, or BMT, nurse coordinators before your admission and the inpatient BMT nurses who cared for you during your hospital stay for transplant. Now you will meet another set of BMT nurses who work in the outpatient clinic and infusion areas, who also specialize in the care of BMT patients. In the first 100 days, your care will be coordinated through the BMT clinic. The number of visits to these outpatient areas can vary depending on your disease and your overall condition. For your safety and theirs, please refrain from bringing children younger than 12 to your clinic and infusion appointments. Remember, the BMT clinic has a 24-hour phone number that you can use in case you are concerned about your condition. Always call 911 if you have a medical emergency. Your transplant team needs to monitor you closely even after you are discharged from the hospital. If you live more than 90 miles away, you will be required to arrange for temporary lodging until your first clinic appointment, which is usually about 3 to 5 days. Your social worker can help you with this process. We are going to take the next few minutes to talk about how your body recovers after transplant. We'll discuss the process of engraftment and how the immune system recovers, including ways to protect yourself when you are at risk for infection. Engraftment means that your new cells are growing and beginning to function in your body. Your neutrophils engraft first. Neutrophils are white blood cells that fight infection. Typically, they start to function in the first 12 to 15 days. You can leave the hospital when your neutrophils engraft. We can tell when your neutrophils are engrafting when we see a rise in the absolute neutrophil count, or ANC, blood test. Your platelets will engraft second. Platelets are blood cells that help stop bleeding. Typically, they start to function in the 14 to 28 days after transplant. Your red blood cells take longer to engraft. They may take up to 28 to 56 days to start functioning fully. You may leave the hospital before your platelets and red blood cells have engrafted. If needed, you will receive transfusions of platelets and red blood cells in the outpatient infusion area to support you while your new cells are developing. Full recovery of your immune system may take 6 months or longer and includes recovery of B cells and T cells. T cells recognize what is foreign, and B cells produce antibodies against foreign cells. Recovery of the immune system cells varies depending on many factors. It usually takes 3 to 6 months after an autologous transplant. During this time, you remain at risk for infection and should take precautions. During your hospitalization, you were placed on protective precautions that included precautions for infection, bleeding, and dietary restrictions. You will follow the same precautions at home while your immune system is recovering. What can you do to prevent infection? You can do a lot. There are a variety of actions that you can take that will help you prevent getting an infection. It is important to follow the directions of your medical team. Here are some of the actions your medical team will recommend. Use a mask if your neutrophil count is low or if you are around construction. Avoid people who are ill, crowds, or kids outside the immediate family who are younger than 12 years old. You can enjoy the family pet you already have at home, but do not get a new pet. Wash hands after direct contact. Let others do the work of cleaning up after your pet has done their business, and no touching reptiles or amphibians. Gardening and digging in the dirt is not allowed. This year, do not have a live Christmas tree in your house due to potential exposure to standing water. Stay away from lakes, pools, and hot tubs because they can harbor bacteria. And avoid areas of construction or where dirt and soil are being moved around. Before you leave the hospital, you will receive a detailed list of precautions. Make sure to discuss any concerns or questions you may have with your medical team or your nurses. Talk with your doctor to decide when it is okay to stop infection precautions. Your personal hygiene is very important. Practice proper hand washing technique. Scrub for at least 20 seconds, especially before meal preparation and after using the restroom. Shower daily to maintain good overall hygiene. Avoid household cleaning because it can dislodge dust, grime, and mold that may cause infections. And avoid any substances that might be irritating to your lungs, for example, aerosol sprays, smoke, and spray paint. You are at risk for bleeding if your platelet count is less than 50,000. In the outpatient infusion area, you will continue to get platelet transfusions as needed to support the recovery of your own platelets. Meanwhile, it is important to avoid activities that might cause you to bleed. We will give you a detailed list of bleeding precautions to follow. Discuss any questions or concerns you have with your medical team or your nurses. Talk to your doctor about when it is okay to stop bleeding precautions. Sexual activity can put you at risk for infection or bleeding, so it is important to follow precautions in the first 100 days after transplant. If your platelet count is less than 50,000, avoid having intercourse. If your platelet count is over 50,000, you may have intercourse, but you must use a condom for the first 100 days to prevent infection. If your partner has sores on their mouth, please do not engage in kissing or oral sex to protect yourself from infection. The BMT dietitian has been working closely with the BMT team to oversee your dietary needs. Knowing what foods you can and cannot eat is important to prevent infection. Obtain a list of these acceptable foods from the BMT dietitian or nurses before you go home. Diet restrictions should be in place until you are no longer on immunosuppressive drugs, are taking very low doses, or as specified by your doctor. Please continue to ask questions about food safety and food choices so you feel well informed. It is important to take your medications appropriately and on time. Transplant patients are prescribed a number of medications which can be difficult to organize unless you have a plan. It is important to keep an accurate list of your medications and when you need to take them. You may select to organize the delivery of your medications by placing them in a weekly pill container so you can see which pills you need to take each day. Avoid running out of your medications and anticipate when you will need refills. Call the clinic 1 week before you expect to run out to avoid problems. Your doctor might have given you a prescription for an opioid pain medication. Opioids are sometimes called narcotics. Opioids cannot be called into the pharmacy and often need a 24 to 48-hour notice to get refilled. You can coordinate opioid refills with your clinic appointment time. Your bone marrow transplant team can answer any questions you have about your medications, so either call or write down your questions to be answered at your next appointment. If you are taking opioids for pain management, you are at risk for constipation. Drink lots of water and keep your medical team informed about how often you are having bowel movements so they can provide you with effective treatment. Home infusion nurses can help you learn to care for your central line or manage home medications if needed. Insurance plans have varying coverage for home infusion, so please check if this service is covered. If it is not covered, it is possible for you to receive your care by coming to the clinic or hospital infusion areas. Infusion areas are available 7 days a week. You will always have access to the BMT medical team once you leave the hospital using the clinic phone number you received. Because you are at risk for infections, bleeding, or other symptoms, it is important that you are in tune to your body and report any new symptoms that you experience. Symptoms are a warning sign that something might be going on, and when you catch symptoms early, it is easier to manage the medical situation. You can help your BMT team by reporting symptoms early. A temperature of greater than 100.5 degrees means that you might have an infection somewhere in your body. You must call your doctor to see if they want you to report to the emergency department. In addition, please call us if you have any of the following signs and symptoms: persistent headache, pain when having a bowel movement or urinating, diarrhea or vomiting, difficulty taking medications or keeping fluids down, signs of new bleeding, new cough or shortness of breath, blurred or double vision, new rash or skin changes, or any neurological changes such as saying something inappropriate or seeing things. Always remember that if you have a medical emergency, you should call 911 immediately. After your transplant, there is a period of adjustment to what will now be your new normal. Although you may not be able to engage in all of the activities that you did prior to transplant right away, you will slowly become stronger and more active as time goes by. This is a time to focus on taking care of yourself by preventing infections, eating well and exercising, and keeping a positive attitude. The journey is just beginning and you need to give yourself time. In some cases, patients need to be readmitted to the hospital. Don't get discouraged. Keep focused on the future and know that by about 100 days after transplant, many people are able to take part in their usual activities. The outpatient team of nurses and doctors will continue to coordinate your outpatient visits and long-term follow-up care. This will include tests to check your lungs, heart, and other organs. You will be tested more frequently if you are having symptoms in any of these areas. As time goes by, you will be transitioned back to your local doctors and oncologist to provide any ongoing follow-up for your medical condition. You can always use the BMT Clinic 24-hour phone number in case you are concerned about your condition, but call 911 in case of an emergency. It is not uncommon for transplant patients to experience mood changes due to their medications or the stress of transplant. If you experience a change in mood that is unusual for you, please contact your BMT medical team, social worker, or nurse to let someone know. It is normal to have anger, agitation, hallucinations, sadness, tearfulness, anxiety, or depression. We are here to support you. Together we can create a plan which may include individual care, support groups, medication, or another intervention that works for you. Gradually increase your activity level, but balance your activity with the appropriate level of rest. Walking outdoors is good for you. But remember, since skin is more sensitive to burning due to chemotherapy treatments, avoid being in the sun altogether or protect yourself with hats, sleeves, and pants. Your doctor may want you to stay in the area for monitoring or treatment, so you should get approval before traveling out of the area after your transplant. Patients receiving a bone marrow transplant are at risk for losing their pre-existing immunity due to the chemotherapy they received during the conditioning regimen. For this reason, all patients are required to be re-immunized. You will receive a series of injections several times starting at 6 months and ending 2 years after transplant. While your immune system is compromised, stay away from friends and family who have had live vaccinations like the nasal version of the flu vaccine. Immediately after your transplant, driving is not allowed because of the effects of medications you are taking. You will need to obtain clearance from your doctor to resume driving. This is usually after a period of about 3 months. Many people will return to work after transplant, but each person will have a different situation, so your medical team will work with you to prepare a plan that will fit your needs. Usually, people who have had an autologous transplant can return to work after about 12 months. Returning to work depends on your medical and functional condition and the type of job you perform. Caregivers are a very important part of the transplant process. They are really the hub of all care that happens for the transplant patient. Being a caregiver is hard, emotionally and physically at times. Be patient, it is a long process. We encourage caregivers to ask questions so they feel prepared for the task of caring for a transplant patient at home. Caregivers need to plan on providing 24 hours a day, 7 days a week caregiving to the patient after discharge. Day plus 14 is the average day that many patients are considered for discharge. Plan on providing care for the first 100 days. Having a secondary caregiver is essential. It is a good idea to have a backup in case of an illness or just to give a break to the primary caregiver. Caregivers need to take care of themselves in order to take care of the patient. We offer support groups specifically for caregivers. Talk to the social worker, nurse, or chaplain to find out more about coping with the challenges of caregiving. It is important to arrange your personal financial situation to assure you receive all necessary medications and treatments during transplant. Our health system has several resources to help. The Guest Assistance Program, financial counseling, and social workers can assist you with your individual situation if you need help. Feel free to ask your BMT team members to connect you to these resources. Advance directives are often a difficult but important topic that must be discussed and reviewed prior to transplant. You might already have your living will prepared and your durable power of attorney appointed, but if you do not, it is a good time to talk with your nurses or social workers to learn how. Make your wishes clear in case you are unable to make medical decisions for yourself. Being prepared for an unexpected situation will set your mind at ease and allow you to focus on staying strong and healthy as you recover from transplant. Your social worker can help you in getting the form and filling it out. The booklet and forms can be found on the Care Guides website at www.med.umich.edu/careguides. Search for the keyword Advance Directives. Palliative care is an important service that we offer to patients to provide an extra layer of support during transplant. The palliative care team works with the BMT team to provide advanced care navigation. This means planning for the future and maintaining hope while considering the unexpected. They also help facilitate consistent, supportive communication with you and all of your BMT team members by understanding your values and goals of care. The palliative care team will also provide you with the resources you need. You can ask your BMT team members if you would like to learn more about palliative care. Thank you for allowing us to share this important stem cell transplant information with you. Now it is time for you to understand your next steps after discharge. Continue to review and learn the infection, bleeding, and food precautions. Attend all of your scheduled appointments, and take all of your medications as directed. Pay attention to your physical and emotional well-being, and call us to report any changes or to ask us any questions. In conclusion, we thought you might enjoy this video featuring patients and family members talking about their experience transitioning home after transplant. This is part 6 of the New Normal video series. If you do not have a copy of the New Normal, here is how you can watch it online. Visit www.med.umich.edu/careguides. Type New Normal in the keyword box. Hit the search button to get the results list, and click on the link to the video. Thanks for watching our presentation. We hope you feel more prepared to go home and start your recovery. If you have questions about this video or the transplant process, please call us at 734-936-9814.